statistics show that the earlier you detect cancer, the more chance there is for survival. At the first time, it's always scary because you don't know what's going to happen. That's true of anything in life, I guess. But once you've gone through it, you'll find that it's very painless, but it's very important to yearly have your mammogram done because you want to detect it early if it does happen.
No one wants to think about being diagnosed with cancer, of course, but early detection is key to increasing your survival rate.
And as we head into Breast Cancer Awareness Month, we'd like to share the importance of getting your yearly mammogram and also some of the latest technology available to help find breast cancer early.
That's right. Sanford oncologist Dr. Shelby Turstrup joins us with information that you should know before you head into your screening. Good morning.
Good morning.
This is like such a great month to keep it in people's minds about get tested, be tested. It's important.
Right. It's not only about awareness of breast cancer, but awareness of what you can do for yourself.
Yes. And so what age should we start getting tested?
Well, there's a lot of controversy around that, which I think makes it confusing for everybody, but we're still recommending age 40 yearly for women. And unless you have a family history of breast cancer earlier than that, we go typically 10 years prior to the first person who was diagnosed with breast cancer.
Oh, really? Okay.
So if you had a family history of your mom had breast cancer at age 40, we would start at 30.
Oh, interesting.
Yeah.
And dense breasts play a big role in all this, right? Which you don't even really think about sometimes.
It plays some role.
Okay.
We, for mammograms, we look at three things for mammograms. One is calcifications, and calcifications can happen. We can see large calcifications in the breast just as we age, if we've gotten trauma to the breast in that area. But we can see small calcifications that line up in a certain way that can tell us that there may be something concerning. The second thing that we look for is any underlying mass. So is there a cyst, a fibroadenoma, or a cancer that's developing? And then once you see that mass, the only way to truly know is to biopsy that area. And then the third thing we look at is breast density. And what breast density is, you know, the breasts are made of fibrous tissue and fat. And when there's more fibrous tissue than fat, we have a higher breast density. And what we know about breast density, it increases the risk slightly of breast cancer, but it also decreases the sensitivity of mammograms.
Oh, okay. So there's a plus to it. I mean, you know, if your mammogram doesn't hurt as much as some people say it does.
Oh, what it would do is decrease the ability for us to see in a mammogram.
Got it.
Yeah, so the mammogram would still be the same.
Oh, okay,
yeah.
okay. Ah,
Squish.
shucks.
Yeah, I know.
It was such a positive there for a quick second. Okay, okay. But I've had them before, and I didn't find that it hurt in any particular way.
Yeah, I think everybody's different. You know, some breasts are more sensitive than others. I think, you know, taking a Tylenol or ibuprofen does definitely help, and knowing that it's a short time.
Right, exactly. And you could get some, you know, pretty significant results from it if you do get it done.
Yeah.
Well, and I think that's the importance too, is just for your own reassurance, especially if it's in your family. And I know I'm going to start getting them soon because my mom has breast cancer. And so I know that, you know, just to make sure and just for that security, because you never know when it's going to come.
Right, and I think that brings up a really important point with if you have a family history of breast cancer in your mom, so we call it a first-degree relative, your mom, your sister, your daughter, or you have a history of atypia yourself, so a kind of a pre-breast cancer, or you have a male breast cancer in your family. Those are things that really kind of are a ding, 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 and we would like those people to be seen in our high-risk breast clinic to get a full risk assessment done, see if there's any medications that we should be using to prevent breast cancer, and also if you have a 20% lifetime risk of breast cancer, we would recommend mammograms in addition to MRIs. So, you know, so that's kind of the highest risk people, and then there's kind of the average risk people.
Interesting. Okay. All right. So much more on this. We'll take a quick break and have much more on this with Dr. Shelby Turstrup when we come back. Stay close.